breakdown on the numbers of cases with mutations, as well as the specific variant lineages. Given the accuracy of the PCR variant test and what we now know about the prevalence of B117 in Ontario, genome sequencing is no longer required to confirm this specific variant, which is the one originally identified in the UK. This is because since we started testing for the N501Y mutation, over 95% of the specimens that were positive for that mutation and negative for the E484K mutation, over 95% of them were found to be of the B117 lineage after genomic analysis. So as a result, reporting of cases that are positive only for the N501Y mutation is now categorized under the lineage of B117. This means we'll see a significant increase in the total number of B117 cases in the report starting today. There are now 9,838 confirmed cases of variants of concern in Ontario. Of those, 9,632 are the B117 variant, first identified in the UK. 75 are the B1351 variant, first identified in South Africa, and 131 are the P1 variant, first identified in Brazil. The 7-day rolling average positivity for mutations or variants of concern is now 63.5%, which is slightly up from 63.3% 1 week ago. As noted in our update on Tuesday, and again yesterday, when the new public health measures and stay-at-home order were announced, the trends we are seeing are very troubling. The number of new cases today, 3,295, is the highest we have seen since mid-January. And when we look at the 7-day case rate per 100,000, the provincial number has increased by 27.3 to almost 121 cases per 100,000. And what is most troubling is that the number of individuals in hospital has gone up and is high, particularly those in ICU. The 525 individuals currently in intensive care is more than 100 higher than the peak we had in wave 2 of 420. Our healthcare system is already strained, and this needs to be immediately addressed before the system is completely overwhelmed and we lose our ability to care for all the patients. Implementing another stay-at-home order and strengthening public health measures is certainly not what we wanted to do, but it is necessary to address the rapid increase in COVID-19 transmission and the risks posed by these events and the variants. These new measures will help to keep people safe while allowing our vaccination program to reach more people. By all of us staying at home and reducing our mobility, we will minimize transmission, protect our loved ones and our communities, help to safeguard the health system capacity, and save lives. So, Dr. Heyer, do you have any questions or comments before we move on?
No, I think we can turn to questions from the media.
Thank you. So we'll turn over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Randy Rath at CH6TV. Please go ahead.
Hi, doctors. I have a question for Dr. Heyer. Yesterday in Niagara, it was impossible to book on the portal any appointments to get a vaccine shot for people over 60. There were just none available. We asked Niagara Health what was going on. They sent us we asked Niagara Public Health, they sent us to Niagara Health. Niagara Health responded to us today saying that when the provincial booking tool was open to adults aged 60 and over yesterday, approximately 4,700 appointments were available at a hospital clinic for the week of April 12th. This is referring to the hospital clinic at the Montana Sports and Entertainment Center. They said that for that same week, Niagara Health had reserved approximately 6,000 appointments for frontline education workers. And that hopefully by April 20th, there will be more shots available for those 60 plus. It seems that frontline education workers have overwhelmed the system so that there's no shots available for anyone else. Is that good public health policy?
So it's difficult for me to comment specifically on the individual events in Niagara because I don't have the detailed knowledge of everything that you're describing. What I can say is that what we focused on from a vaccine rollout perspective is age and at risk, and that there's clear link that the best predictor of illness is age, and certainly as the age increases, so above 80's far greater risk than would be somebody over 60 just by age alone. But then there are other risk factors that are important to consider: where people live, where they specifically reside, and then as we move through those, there are people who are also at risk by their location of employment and where they might spend their time working. So each public health unit has flexibility within the broader provincial direction, and at times there are particular reasons why a public health unit may approach their vaccination rollout plan in their own specific way.